Trauma Therapist Podcast, episode 521.5. All right, welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to raise the awareness of trauma and to support and inspire new trauma therapists just starting out on the trauma-informed journey. I do that with my membership community, Trauma Therapist 2.0, my online courses and workshops, and the Trauma Therapist newsletter. If you're a therapist of any kind and you work with individuals who've been impacted by trauma, I invite you to head on over to my website at thetraumatherapistproject.com. That's thetraumatherapistproject.com. All right, let's get started. All right, you ready to do this?
Sure thing.
All right, so let me just get this going here, make sure we're recording. All right, so 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am super excited to have as my guest today, Dr. Nicole Anders. Nicole, welcome.
Thank you so much.
All right, so Dr. Anders is a licensed clinical psychologist, author, speaker, and yogini. She currently lives in Las Vegas, Nevada. Did I pronounce that right? Yogini?
Yes, yogini is the feminine of yogi.
Oh, awesome. Mm-hmm. Specializing in trauma treatment, PTSD, and women's health, Dr. Anders is trained in numerous evidence-based psychotherapies, such as prolonged exposure, cognitive processing therapy, and acceptance and commitment therapy. Nicole believes strongly in the mind-body connection and finds ways to merge the worlds of psychology and yoga healing, bringing many forms of somatic therapy into her clinical work. Dr. Anders often works with patients on issues related to psychedelic science, including intention and integration. She's the author of 100 Goodbyes, a memoir dedicated to her younger brother that depicts her journey through grief and loss. And she's currently authoring her second piece titled Intention and Integration, which is set to release in 2021. All right, so you are busy. Welcome.
I am busy. Yes. Thank you. Thank you. And I just had a baby, so we might push that release date to 2022. But,
wow, exciting. Congratulations.
Yeah,
Is this your first one?
You. My second little boy.
One. All right. Mm-hmm. Awesome. Well, let's start. First of all, share with our listeners, Nicole, where you're from originally and where you're currently from.
I'm from all over, but I'm Canadian. So we'll go with that. Home is Canada. I'm from Vancouver. My parents still live in Vancouver, and I go back. Well, we haven't been back in a while, but because the borders are closed. But we go back typically several times a year. So Canada is home.
Okay. And what brought you to Vegas? I have family in Vegas.
Yeah, Vegas. The sunshine brought me here, but also my brother, the one who passed, the one I wrote the book about, he used to live here. And so I moved here in 2016. He still was alive for a few years. And I knew that he wasn't doing well, and I wanted to move closer to him. So I came and started working out here.
Okay, awesome.
Yeah.
All right, well, let's jump in here. What got you into this field of, well, let's start broadly and then we'll kind of dial in, but what lured you into yoga originally?
Oh, yoga. Yoga is my healing. Yoga is my therapy, other than therapy. Yoga really helped me heal through my own grief and loss and traumas in life. And I found it to just be this magic little thing that you do on the mat with your breath and your body. And it healed me so much that I wanted to become a yoga teacher. So I believe it was 14, I went to Bali, Indonesia, for about a month, and I was trained in a yoga teacher training there and had a wonderful experience. And I've been teaching yoga ever since. And then when I moved to Vegas, I actually met a woman named Joyce Boson, who is now family to me. She is the founder of Trauma Recovery Yoga, T.R.Y, T.R.Y Yoga. And it's a nonprofit organization here. And we do yoga for traumatized populations, and I still work really closely with them, teaching a part of their teacher training. I teach the psychology of yoga, and I talk about interpersonal neurobiology and all sorts of things like the brain and the body and what goes on when there's trauma and how yoga can help heal that.
So you mentioned your own healing and working with trauma. How did that interest in working with others who'd been impacted by trauma, how did that evolve for you?
Yeah. So when I was 14 years old, my mom passed away from cancer, and that was trauma. That was my big trauma, first big trauma.
Wow.
And I healed through that with therapy. I found my father helped me find a really wonderful therapist when I was a teenager, and I didn't really understand what it meant to be a therapist or a psychologist or anything. And I just kind of said, what she did for me, I want to do for people, and just always knew that I was going to be a clinical psychologist. Didn't know what it really meant and the work that it entailed, but I never met a challenge I couldn't, face. And so just my own experience of how important that connection was with her. And it's funny because I saw her probably weekly for about 2 years, and I don't even really remember what we talked about, but it was just how she made me feel and how she was like this safe person for me. And that's changed my life and saved my life, because unfortunately my brother went a completely different way. And I just was like, hey, this is what I want to do for the world. There's so much hurt and pain, and I want to be that safe space that make people feel like they matter, because they do.
It's interesting that you said that, it wasn't so much what she did, and it's how she made you feel. And that's said I think within the field of psychology, but oftentimes it's easy to forget that, and it's very easy, I think, sometimes to, certainly from my own experience, just to be lured into thinking that the important thing is just the intervention and
Right, the
getting
protocols.
I was like that. What do I need to know? What knowledge do I need to suck in that's going to make me like the best trauma therapist I thought I could become? And I neglected exactly what you were talking about. And so it's kind of great that you mentioned that.
It's a good reminder. I remind my trainees and my interns and my students all the time when they get caught up in, prolonged exposure, cognitive processing, EMDR, all these things. It's like, just sit with them.
Right.
And sometimes that's enough.
Right.
Yeah.
So, I can't help but just, your mom died, your brother died. Jesus.
Yeah. It's been a lot. It's been a lot on my heart.
What happened? So how did things evolve? So at what point did you get into start pursuing psychology and wanted to become
pretty much right away.
Okay.
Yeah.
So after high school, college, blah,
Yep.
blah, blah.
I went into college, and I mean, even in, I think, high school, I might have taken some type of intro, something or other. I don't even know. I've taken some college level stuff, but yep, jumped right in, got my undergrad in clinical or in just psychology with a minor in Spanish. And then I just went right away into a program and got my PsyD. So it was a 5-year, master's along the way of clinical psychology. And I did that in Southern California, and I did my internship and my postdoctoral fellowship actually in Puerto Rico because of my bilingual abilities. I landed a pretty cool bilingual internship out there at the VA hospital in San Juan, Puerto Rico. So I got to have some fun out there while I was studying. And then I just transferred to the VA here in Las Vegas. And, I just always knew I loved it. I loved the coursework. I loved learning about the new theories. And, I'm very psychoanalytic in my thoughts. And I loved learning about Klein and Freud and all the people, and just how people work has always been so fascinating to me. And of course, I think a lot of us, we get into it because we want to figure out our own lives. And that was definitely the case for me. And I wanted to understand my healing and continue to heal. And when I got more into somatic therapy and learned about like interpersonal neurobiology and Dan Siegel and Pat Ogden and Gabor Mate and all these people. And I just kind of dove into that. And that's where yoga became this beautiful complement. So I wanted to learn how to teach it so I could, not only use it, but teach it as well. And I kind of see myself as a holistic healer in a sense. Yeah.
And then at what point in this kind of time frame did things start happening with your brother, and what happened? If you want to share that.
I'd be happy to. Yeah, sure. I wrote a whole book about it, so I'm pretty much an open book. It started from the beginning when our mom died. That was the trauma, right? And he was younger. He was 11 or 12, and he was a boy. And so I think culturally, and he was an introvert. So like all these pieces, right? He wasn't taught to express his emotions. My dad got him into therapy and he didn't like it. He quit. And so, that wasn't forced on him. And he turned to substances kind of originally in high school, the way that many people do, in a very developmental, experimental kind of thing. And it just, one thing led to the next. And one day he was using opiates, and that led to heroin use. And he accidentally overdosed on fentanyl. And we have a huge opiate crisis right now, and fentanyl is laced with everything. And the toxicology report showed it was pure fentanyl. And I'm certain, and have been assured by his friends, that he would have never bought pure fentanyl. So I always say it was a fentanyl poisoning. But I think, that's the facts of it. But really what was happening was this little boy who never healed this huge mother wound and these attachment and this trauma. And he found substances and it felt good. And opiates are a painkiller. So he was killing his pain, and
it was working.
It was working. And he was, and Gabor Mate always says, don't ask why the addiction, ask why the pain. And I love that, because he was a human being behind all this. And unfortunately, we got the news in 2018, and it was devastating, and re-triggered my own grief. And I started writing and wrote a book about it, and have used that to connect with people, and just kind of, I think that's the healing, right? Is the connection. And it was kind of a little bit intimidating to put a book out about my life being a therapist, especially coming from a psychodynamic background. Keep the frame, be neutral, all that. So putting my life out there has been a little bit vulnerable and scary at times, but I've actually found it to be this blessing that I can connect in a really open way to the world. So
what did you want to, I feel this topic is so complex and so delicate, and intimate, and speaking with you, what did you want to get through in that book?
I don't think I started it with any intention other than to heal myself. It really wasn't even meant to be a book. It started out as an Instagram account where I just did posts, and then I wrote some chapters, and it became this thing. But what I started seeing was people would message me of how impactful my words were and how they appreciated my vulnerability. And then I felt less alone, and they felt less alone. And it was the connection. And when we're in grief, no matter how anyone passes, right? Because the books, people who have lost people to cancers and different things have still connected to the book. We feel so alone, and we just miss that person, and we feel like we're in this very isolated state. And I guess I walk my readers through this journey of what really happened for me. And I hope I put like a bit of a psychologist spin, explaining things, and people just tell me, wow, I really connect. And that's all it is. It's connection. It's all I ever wanted. And that's, I think, what it's creating. So it's beautiful.
I think that's so powerful. When you said you felt vulnerable, and I think there's so much, I admire you for doing that. And I think there's so much courage in doing that. And I think we need that. People need that. And they respond to that. People respond to someone like yourself walking out on that ledge, in a sense. And, you said kind of bearing your soul, in a sense.
Yes.
And I feel it can be healing for a lot of us, who've lost people.
Yeah.
Geez. Okay.
Yeah.
So
No, it's been wonderful. And I'm, I've reread the book myself kind of when it came together. And, I encourage my patients to journal a lot, and because I think it's very therapeutic, but I always say, make sure you go back and reread your journals so you can see where you were and see your thought process. So for me, even the rereading of it has been healing, and I'm proud of it. So thank you for saying that.
Yeah, you're welcome. So you're working on something else now?
Yes. My second book that will birth its way into the world after. Now I think I'm done birthing humans, so I'll birth some more books. It's called Intention and Integration. That's the working title. And it's focusing, it's not just about psychedelic integration, although I know that that's a big, in our world of psychology, where, there's psychedelic science and there's maps and there's, we're looking more into how we can, it's funny because I've read a book about substance use and how it's harmful, but how we can use substances, like MDMA for PTSD, these kinds of things. And I'm not formally trained in any of that, but I talk about how if you're going to do an experience like that, whether it is psychedelics or whether it's yoga or whether it's breath work, because, anything holistic, a holistic experience, there needs to be an intention beforehand and an integration afterwards. And I think that can be applied to a lot of things, but you really want to say, why am I doing this? What, even every yoga class, that sometimes they ask you to do an intention before you do a 30, 40, 60-minute class. Why are you here? What's your intention? What do you want to get out of this? Right. And then afterwards, integrating, what was that like for you? And what did you learn? What did you gain? And so the book's not so much about the experience, because that can be that, the person can choose, but I want to talk about the before and after that I find to be incredibly important, especially with psychedelics and things like that.
Why do you find that so important? I mean, it is, but why do you feel it's so important such that you're writing something about it?
Yeah. Because I think we live in a world where we lack intention, gratification. People are impulsive, right? Facebook, all these things, and Instagram and phones and screens. And I think bringing intention to what you do is important. Bringing intention to your healing. I don't think you should just go to therapy to go to therapy. There should be it can unfold, but should there be some sort of intention? So really helping people to understand why you're doing what you're doing and what would you like to manifest from it. And then the integration piece afterwards, like if someone was to do, use MDMA for PTSD, which is something that's been really studied and is coming out to be bigger and bigger. That's a really huge experience that can be overwhelming and confusing and fill in the blank. And if you don't have, of course, a safe container throughout, but afterwards, that space to integrate, it might just be, like you're going to Disneyland and seeing all these lights and colors and feelings, and then whoop, we're off the ride, and that was cool, but how does it apply to my life? And I think as psychedelics become more, widestream and widespread, people are going to be doing them in hopefully safe containers, but also not. And just knowing that, the work isn't that experience that day, that 8 hours or however long, it's the aftermath. So for me, I think that's why I want to write about those pieces, because there's so much focus on the events that we need those other pieces.
Right. Yeah. And, as you're talking, Nicole, I'm thinking to myself, I almost can't help but think that, the experiences that you've had in your life, I mean, have been so just kind of markers. And you seem to be someone who's very cognizant about how the things in your life, the experiences in your life are not only impacting you, but how you can utilize them to help others. That to me is very powerful.
Thank you. It's come with my own work, I will say, right? Every therapist needs therapy.
Definitely.
And I've definitely done a lot of my own work on and off the couch. And so I appreciate that.
Yeah. What do you think, as you move through this, I mean, you seem to have a lot of kind of interests and kind of quivers in your, or arrows in your quiver to utilize to help people. What do you think with all that allows you to engage with others who've been people who've been impacted by trauma, whether they're women or men or whomever?
Yeah, you're right. I do have all these different pieces and I have a lot of interest, but I think it kind of goes, I hate to circle back, but I love to circle back because that's, the skill of the therapist is what we talked about almost at the beginning of this, is not any of what it is that you do, but just sitting with people, sitting with them is my most powerful tool, and going through the work myself has allowed me to just break open and crack open with empathy. And I don't even need to tell my patients. I don't tell my patients about my life, but I think they feel that. I think they feel that this is a person who's not just, quoting her textbooks. This is a person who who knows pain, who knows emotions, who's been through healing. And I think on some ways they just sense that. And I think that's my biggest skill, is to tap into, wow, what was that like for me? Or what would that be like for me? And really, really, really embody empathy.
Right, right. Yeah, that's huge and that's awesome. Right. And not that you need to share your own life story, but was that, talk a little bit about your journey in getting to that place. I mean, you talked about from a very early age kind of being or having an affinity with psychology and helping people. Was that always the case for you? Did you always have that sense or embodiment about yourself?
Yeah. I love people. I'm an extrovert, so I think it comes with being an extrovert. And, the more I got into my own healing, and saw that even though I have, this long list of traumas that have happened to me, like huge losses, and that doesn't include, the breakups and the different things that have happened in my life as well, that I could be okay, right? That I could take a different path, and I don't use substances, and I could be okay. It really showed me, okay, if you can do this, you can teach others how to do it. And so I practice what I preach. And yeah, I've always wanted to connect with people. I find people fascinating. I love people's stories. And that's kind of also what inspired me to write my own, because I'm so fascinated by people's stories. I feel like everyone should write a book. Everyone has many books in them. And I wrote mine, and put that out there, and just continue to connect with people in that way. So,
How about an early clinical error?
yes, I thought about this. You sent an email saying you might ask this question. So I thought about a lot, but what stands out for me was my very first patient, because it always is, right? The anxiety is so high. I'm in my very first practicum. I think I was like 21 years old, right? Started grad school, something like that. And I really at that time wasn't in tune with my own privilege and my own presence in the room, and how I used to look through a heteronormative lens. And so when I was asking, it was an intake, and I was asking this sweet young woman across from me, I said, kind of casually, almost like trying to connect with her, be friends, but not. I was like, "Whoa, so do you have a boyfriend?" And really kind of almost went to that chit chatty place. And she had a girlfriend, and never in my life have I felt so like I put my foot in my mouth. I just was being so blind to the diversity. And it taught me from that day, from that second, to remember diversity and remember people's stories, and to never assume. And I'm sure, I think it was a common error, and I'm sure she never came back. So the rapport was lost. But I'll never forget that. And it's taught me that even though I wasn't being harmful, just to don't assume, and let people tell you their stories, and to really keep that lens clean, and not project your life. Because I was a young female, she was a young female. I just was almost trying to find maybe a bit of a non-professional way to connect with her. And I learned really quickly that wasn't okay, and took my foot right out my mouth. So
yeah, interesting. It made me, I mean, first of all, I'm glad you shared that. And it
yeah.
made me think about a lot of my foot and mouth situations. People listening to this, Nicole, are new therapists just starting out kind of on their trauma informed journey, in a sense, therapists with experience. For those people who are listening to this and being inspired and struck by you and your story, because I know that's going to happen because of how you are and who you are and what you're sharing right now, in terms of wanting to learn about becoming a holistic healer like yourself, or and getting more informed about trauma, what would you say to them? What advice would you give to them?
My first piece of advice is do your own work, especially in the field of trauma, because nobody I know doesn't have their own trauma, that doesn't have their own pain, especially therapists, right? And I don't think going and getting a degree, master's, PhD, whatever, is enough to say that you healed your trauma. You didn't. So if you want to know about holistic healing, get on the mat, right? Sign up for a yoga retreat, go to do some breath work, go to your own therapy, heal your stuff, because if not, it's going to come out. A lot of people ask me, like friends say, how do you do this? Like, you listen to these really painful stories of sexual abuse and, combat and all this stuff, and not be shook by it. And first of all, I am shook by it. So it's okay to be impacted by your patients. I guess that's my second piece of advice. But why it doesn't devastate me and why I can hold that container and frame is because I did my own work. Mm-hmm. So for anybody who really wants to get more into this world, I encourage them, and they can totally reach out to me. I always respond, and happy to share continued, about my journey. Anyone who wants to know more about yoga or anything. But I think you need to do your own work so that you can be that safe container. And then when you do, you can be impacted by your patients. It's not like you shut down and compartmentalize. You can sit with them and feel with them, but not in a way that just throws yourself off and your whole day off and your life off. So a healthy distance while still being with them.
For those people who haven't, yet pursued yoga or experienced yoga or maybe dived into it more, why do you feel that's important, or how is that important? You said get on the mat.
Mm-hmm. Yeah. Well, what we know, without going into biology and science, but what we know about trauma, right, is the fight, flight, freeze response. Basic trauma, it's in our amygdala, it screws up our frontal lobes, the whole thing. And when our body and our central nervous system is overactivated, we need to find a way to deactivate it. And so talk therapy is beautiful because it can kind of, help you make meaning of what happened. But in the moment of the trauma, in the moment, right, your body reacts before your cognitive thought. So your body's impacted, and we freeze and we tense up and we have these reactions. And then later we go, oh, wow, that was scary. We label it. Oh, wow, I was scared, or that was dangerous. And we put the cognitive meaning to it later. And it feels like it could be seconds later. But really our body is impacted first and foremost. And we go to to therapy and we talk about it. But until you actually also move the body and move and use the breath to get to those stuck pieces of when the body was in freeze or it's in fight, you're only doing a part of the work. Mm-hmm. Right. So it's helpful to do therapy, but until you add that component where you heal the body, you're not going to fully, work through the trauma.
Right. Awesome. Yeah. All right. Let me just remind everyone that I'm speaking with Dr. Nicole Anders. Nicole, what's the best way for people to get in contact with you?
Yeah. So my website is drnicoleanders.com. So there's all sorts of things on there. And my Instagram for my book is at Cody's Big Sister, CODYS Big Sister. Okay. So, reach me on any of those platforms.
Okay. We'll have that linked up at the show notes page at the traumatherapistpodcast.com. And how about a go-to book recommendation, whether trauma or yoga related or not?
Listen, anything by Gabor Mate. I'm his fangirl. And, his book In the Realm of Hungry Ghosts changed my entire view on addiction. When the Body Says No talks about that mind body. I love everything that he writes. Mm-hmm. So anything Gabor, I highly recommend.
Awesome. All right. Well, look, it's been a pleasure, and congratulations again on the new addition to your family. How exciting is that?
Thank you so much.
But you are one inspiring woman, I have to say. And this is why I love doing this, because I get to speak with people like you. And seriously, I just really appreciate taking the time.
Well, I'll chat with you soon, and I'll email you so I can send you a copy of the book.
Awesome. All right. Take care.
Have a great day.